Welcome to NCLEX RN exam practice test. Our topic today is health promotion and maintenance. Use the link in the description to download the app on the App Store for free practice tests. Number 1. A 25-year-old girl comes into the hospital with a positive pregnancy test. To calculate her due date, which of the following does the nurse need to know? A. The first day of her last menstrual period. B. The length of her menstrual cycles. C. The last day of her last menstrual period. D. The last date that she had intercourse. The correct answer is A. The first day of her last menstrual period. Explanation. A woman's due date or estimated date of delivery can be determined by using Nagel's rule. Estimated date of delivery equals the first day of the last menstrual period, plus 1 year, minus 3 months, plus 7 days. It is based on a 28-day menstrual cycle and a 40-week gestation, which truly makes it an estimate. Number 2. What color does Latia alba have? A. Bright red. B. Brown pink. C. Yellow. D. Dark red. The correct answer is C. Yellow. Explanation. After labor, a woman will have continuous discharge as the uterus sheds the pregnancy lining and returns to its original state. This discharge is known as Latia and may last 5 to 6 weeks. Alba Latia is described as vaginal loss which has turned yellow-whitish. It typically lasts from the 2nd through the 3rd to 6th weeks after delivery. Number 3. A mother tells the nurse that her 2-year-old child does not let her choose his clothes. He runs away and yells no every time she tries to get him dressed. According to Erickson, the nurse interprets that the child is experiencing which psychosocial crisis? A. Intimacy versus isolation. B. Trust versus mistrust. C. Initiative versus guilt. D. Autonomy versus shame and doubt. The correct answer is D. Autonomy versus shame and doubt. Explanation. Erik Erikson's theory of psychosocial development describes a series of 8 stages that take place throughout the course of life. Autonomy versus shame and doubt is the second stage of Erikson's stages of psychosocial development and occurs between the ages of 1 to 3. According to Erikson, children at this stage are focused on establishing independence. They begin to express a greater need for control over themselves and the world around them. This is the me-do-it stage. Number 4. The nurse is educating the parents on the use of child car seat restraints. What level of prevention is the nurse practicing? A. Primary. B. Secondary. C. Tertiary. D. Quaternary. The correct answer is A. Primary. Explanation. Primary prevention's goal is to prevent the initial occurrence of a health problem, such as a disease or injury, through activities such as immunizations, smoking cessation, fluoride supplementation of water, promotion of seat belt use, and use of child car seat restraints. Interventions are often aimed at the general public or large groups of people. Number 5. A patient with coronary artery disease comes to the clinic and asks the nurse which food he should eat and should avoid. The nurse recommends a cardiac diet. Which of the following should not be included in this diet? A. Whole grains. B. Red meat. C. Oily fish. D. Avocados. The correct answer is B. Red meat. Explanation. The cardiac diet is an eating plan that can help you minimize the impact of your diet on your heart health. This diet limits salt, canned and processed foods, and high-fat foods. Red meat, beef, pork and lamb, is high in saturated fat and cholesterol, which increases your risk for heart disease, so it should not be included in the cardiac diet. Number 6. Which is the correct order for an abdominal assessment? A. Inspection, palpation, percussion, auscultation. B. Inspection, percussion, palpation, auscultation. C. Inspection, palpation, auscultation, percussion. D. Inspection, auscultation, percussion, palpation. The correct answer is D. Inspection, auscultation, percussion, palpation. Explanation. The 4 basic methods or techniques that are used for physical assessment are inspection, palpation, percussion, and auscultation. Use them in this sequence unless you're performing an abdominal assessment. For an abdominal assessment, auscultate before palpation and percussion, as these can alter the presence of bowel sounds in the patient. So the correct order for an abdominal assessment is inspection, auscultation, percussion, palpation. Number 7. The nurse is assessing the 1-minute Apgar score of a newborn baby. On assessment, the nurse notes that weak cry, heart rate 120 beats per minute, pink body with blue hands and feet, active movement, crying when stimulated. What would this infant's Apgar score be? A. Apgar 7. B. Apgar 8. C. Apgar 9. D. Apgar 10. The correct answer is B. Apgar 8. Explanation. The Apgar score is a cumulative score of 5 assessments, done 1 minute to 5 minutes after birth. They are appearance, skin color, pulse, heart rate, grimace, reflex irritability, activity, muscle tone, and respiration, breathing effort. Each assessment receives a 0 to 2 score with a maximum total of 10 points. This infant scores a 2 in pulse, grimace, and activity, but in the appearance and respiration assessments, she would score a 1 for each. Hence, her total Apgar would be 8. Number 8. To prevent heat loss after birth, the nurse's first action should be A. Dry the infant. B. Cover the infant with several warm blankets. C. Assess the infant's body temperature. D. Assess the infant's 1-minute Apgar score. The correct answer is A. Dry the infant. Explanation. After birth, the infant is wet with amniotic fluid and blood, and heat loss by evaporation occurs quickly. Therefore, to reduce evaporative heat loss, the infant should be dried right after birth. Number 9. A new mother comes in 10 days postpartum. The mother complains that she feels pain and a burning sensation in the right breast, especially when breastfeeding. On assessment, the nurse notes a swollen right breast with skin redness and nipple discharge. This is most likely what condition? A. Postpartum depression. B. Sheehan syndrome. C. Mastitis. D. Fibrocystic breast disorder. The correct answer is C. Mastitis. Explanation. Mastitis is a common infection and inflammation of the breast due to bacteria, often Staphylococcus aureus. Risk factors for mastitis include sudden cessation of breastfeeding, poor hygiene, prior colonization with Staphylococcus aureus, and broken skin on the breast. It is important to note that doctors often recommend that a mother continue to breastfeed despite the infection. Symptoms include fever, nipple pain or discharge, breast pain or swelling, and pain with breastfeeding. Number 10. Which vaccine is given at birth? A. Hepatitis A vaccine. B. Hepatitis B vaccine. C. Measles, mumps, and rubella vaccine. D. Haemophilus influenzae type B. The correct answer is B. Hepatitis B vaccine. Explanation. All babies should get the first shot of hepatitis B vaccine within the first 12 hours after birth. This shot acts as a safety net, reducing the risk of getting the disease from you or family members who may not know they are infected with hepatitis B. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.